now, but I wanted to let you guys know. So I'm just coming back from the dermatologist. I go to Schweiger Dermatology in Yonkers, New York, and so my hypertrophic scar I wanted to update you on, and I'm gonna insert some pictures so you can see before and after my first steroid injection, because I got a cortisone shot in the scar. So you see a band-aid is on it right now. So my doctor just injected it, and she does like this cross injection technique inside the scar. So here's the back history. So for those of you who know, I had wrist surgery on February 14, 2022. It's called ORIF, open reduction internal fixation, and my surgeon, he used internal stitches, which are like the ones that are supposed to dissolve. I'm thinking they never dissolve because I had them on my knee and I could literally see the stitches fall out. I didn't see anything fall out. Or it could be because of this area, because I was doing a lot of movement. But the thing is that my scar formed into a hypertrophic keloid, whatever scar, and I hate it. It's ugly, it's big, it's huge, and it's like so disgusting. And I'm going to a plastic surgeon also because my plastic surgeon wants to do what's called scar resection on the scar, where they just remove the scar and just close the two normal areas of skin together on the side. But they want to do keloid injections, cortisone injections first, just to make sure that, to see if that works, and if that doesn't work. But I must say that this is my 4th injection, because I got them 2 weeks apart by both doctors, and I noticed that the scar did flatten on the 2nd injection. But sometimes it looks like it gets, like the 3rd one that I got like maybe 2 weeks ago, it looked like it made it bigger. But the bottom of the scar, so I'm going to show you guys what the scar looks like later when I take the band-aid off, because it does bleed a bit. Sometimes they numb it first, but they don't really have to numb it, because it really doesn't hurt me at all when they stick it in. But when the scar was so sensitive before, it hurt so bad, like I couldn't even get it injected. They had to numb it first. But now, since it's the cortisone, it's taken away a lot of the inflammation, and there are a lot of nerve endings there, and it's kind of numbing that. I noticed that I don't feel any pain at all. So I'm going to update you guys and show you what the scar looks like when I take the band-aid off, and then I'm going to show you what it looks like after. And again, I go to Schweiger, SCHWEIGER Dermatology. It's all over New York City. I go to the one in Westchester County. This is also my doctor. The doctor that I see, she's a physician's assistant. Her name is Megan Lee. And her last name is spelled L-I, Megan Lee. She also prescribes my tretinoin, which is my retin-A for my skin, 0.05%, and the ketoconazole cream to get rid of the fine bumps that used to be here in the T-zone area of my face and all over my face. So guys, I'll come back to you with an update in a few, and I'll let you know about everything. Thank you. Hey YouTube, hi guys. I wanted to talk about my scarring. So for those of you who don't know, this video is going to actually be on both channels. It's going to be on my What Should Matter channel, and I would like you guys to go subscribe to that channel if you're not already subscribed, and my regular channel, soy_sweet99. And on my channel, I have a couple of videos that shows where I broke my wrist February of this year. It is now October, so it's about 7-8 months ago. And I had wrist open reduction internal fixation surgery on my right wrist. So I now have basically almost full range of motion. I can turn back and front. But the one thing is, and you gotta excuse me guys, I'm kind of trying, I don't want to seem like I'm rushing this, but I just came in from a funeral, and you can see I'm still dressed, and I just wanted to do this really quick before I went to bed. But I had open reduction internal fixation surgery, and the doctor that did my surgery, he did internal sutures, internal stitches. And they were supposed to fall out, but the stitches, I never saw them fall out. I had knee surgery, back surgery. I've had stitches in my arm right here. And my skin doesn't keloid. I've never had a keloid, never had a hypertrophic scar. Had a nose ring that went bad, never had a hypertrophic scar. So what happened, and I'm going to show you, you'll see pictures in this video of my scar. So my scar, I could kind of tell something was going on with it. If you look at my other videos, you'll see when I started showing you when the scar was starting to turn hypertrophic. So I'm taking off my jewelry so you can see. So today I went to the dermatologist. I go to Schweiger Dermatology in Yonkers, New York, but they have it all over New York, in Manhattan, in the city, everywhere. So my dermatologist suggested that I do cortisone shots in the scar. And I'm also seeing a plastic surgeon who I was referred to for plastic surgery to do scar resection surgery to remove the keloided area or hypertrophic raised area. And then basically just join the two perfect skin together. But my dermatologist and my plastic surgeon are trying to see if this steroid thing works. Now, I'm going to insert pictures of before and after. This is my 4th injection today. So I received the first one, then I got another one 2 weeks after. One from the plastic surgeon, one from the dermatologist, one from the plastic surgeon 2 weeks ago. And then I just got one earlier from the dermatologist. So this is my scar. So I'm going to show it to you close up. This is my scar. It actually looks better because this sucker, you'll see in the pictures, was ugly. It's still ugly to me. I hate it. I'm conscious of it. I always wear my jewelry on top of it, my watch and stuff, because I cannot stand the way this scar healed and the way it looks. So my scar, again, like I said, is right here. And I personally could feel when it was starting to, I kept feeling like I thought it was going to look like this when I was doing, because I did occupational therapy. I probably only did like 7-8 sessions. I did a lot of my therapy at home using barbells and canned foods and, you know, putting my hand on the table up and down like this. And when I kept doing those movements, especially like extension, I could feel like literally like the like the gush, all the stuff, like my scar was ripping. And I'm like, this thing is not going to heal good at all. So now basically I'm on my 4th cortisone shot. I think they use KELOID, something, but it's cortisone. And when I first had it done, the scar was so sore that I couldn't even rub it and touch it. So I can't say that the cortisone shots are helping with the actual sensation. The sensation itself was like terrible. I couldn't even touch the scar without me having any pain. So the shots have been helping with the pain. Is the scar, you know, is it reducing in size? Maybe a little at the bottom, like down here. This part right here kind of got a little skinnier. But in general, I feel like the top of it is ugly and it hasn't changed at all. So I go back in November for another follow-up visit, and the plastic surgeon is going to see what the next step should be, because I personally feel that it's not working. I've been using scar sheets from Scar Away. They're the clear ones that last 90 days. You leave them on for 10 days. I had them on a table. I don't have them anymore, but I wanted to show you guys those. I usually wear them because I want to cover the scar, because I just don't like the way it looks. So I'll have my jewelry, my watch and everything, and I'll have the Scar Away sheet. But I don't like the way the scar looks at all. And the Scar Away sheet is softened it a little. Trust and believe, I did it for a whole, probably more than 90 days. I did 2 90-day sessions, and it did nothing for the scar. And one thing about the Scar Away sheets is that when you put any grease on, if you put your hands in your hair and you have grease, if you're sweating, they come off. So they don't even last that long. They say to try to keep one sheet on for 10 days, but they don't last that long. Excuse me, I'm drinking my strawberry milkshake too. So I feel personally that the Scar Away sheets may work for some, but for my type of hypertrophic scar, it might have flattened it or softened the scar a little bit, but I feel like it probably needs longer than 90 days for it to work. Maybe a whole year, like without taking them off. So I'm going to provide you guys with an updated video on my next visit, and I'm going to record my dermatologist and my plastic surgeon so that you guys can hear exactly what they're saying. So I want to hear from anybody in the comments if you have had the type of wrist surgery that I have, because I have a metal plate right here and I have 9 screws. So if you've had open reduction, internal fixation, or even any type of surgery on your wrist, your arm, and you had an hypertrophic scar after surgery, please comment below and let me know what happened. What did you do for it? Do you still have the scar? Is the scar gone? What did you do? Did you have internal stitches? Did you have staples? Or what happened? Because I am actually really on this theory where I feel like that the internal stitches leads to this, or when your stitches don't come out, I feel like it's an infection somewhat of my stitches. So if you've had them, just let me know. My physician's assistant that I see, my doctor at Schweiger Dermatology, her name is Megan Lee. She's really good, really good. So I did make another video about the tretinoin that I use on my skin, and that's what keeps this 46-year-old skin looking pretty youthful at my age. And Schweiger Dermatology is really good. I've been going to them for years. So tretinoin is actually really good, and I've been using it. So when I went today to the dermatologist, I also got a refill on my tretinoin. She usually writes the prescription. I use the cream, 0.05%. And then for my skin as soap, I swear by Neutrogena. I don't use any other skin on my any soap on my skin except Neutrogena. Okay guys, so I just wanted to just come to you with an update real quick about my scar. I'm going to insert some pictures so you can see the progress of it. I'm going to show you guys what it looked like at its worst and at its best. And well, this is the best that it's been so far. So you guys have a great day. Please subscribe to my channel, both of them, which is with me and my 2 sisters for life, Stephanie and Melissa K. What Should Matter channel, and then also soy_sweet99. Thank you guys and have a wonderful day.